And we thank you so very much for taking time out of your day to learn a little bit more about Penny, to learn about who we are, and more importantly, how we can help the uninsured here in Pennsylvania. I'll start with our name. Our name is pretty straightforward. PENN is Pennsylvania. I is insurance. E is exchange. We are the official replacement for healthcare.gov here in Pennsylvania. We launched on November 1st of 2020, and going back in time just a little bit, we were actually born out of some very forward-thinking legislation that resulted in unanimous bipartisan support that passed both chambers of the Pennsylvania General Assembly and was signed into law on July 2nd of 2019 by Governor Wolf. Prior to Penny's launch as the marketplace for Pennsylvania, on an annual basis, we were paying about $98 million a year back to healthcare.gov every year by way of enrollment fees. Again, there were a lot of folks that thought, you know what, we can set up a competitive marketplace here in Pennsylvania. Ultimately, that benefits our customers. We can also take some of those enrollment fees and set them aside in a reinsurance program here in Pennsylvania that will help regulate the rates and premiums that people pay in the individual health insurance market. So basically, for the price of one program, which was healthcare.gov, Pennsylvania now has two programs that help people from the vantage point of making not only quality health insurance accessible, but affordable. And that's really the biggest challenge that most people have when it comes to health insurance is getting beyond that initial question of how can I afford it? And that's really where Penny comes in. That's where we can help a lot of people, and we do help a lot of people here in the Commonwealth of Pennsylvania, not only connect with quality insurance, all of our insurance plans here at Penny. Number one thing I need to clarify, Penny is not an insurance company. We're the exchange. The insurance carriers, the companies here in Pennsylvania, come to us with their best products. All of our products, and we have three different metal tiers. We have gold, silver, and bronze. All of our metal tiers meet the 10 minimum essential health benefits that are set forth by the Affordable Care Act. Things like outpatient services, emergency services, rehabilitative services, substance abuse and mental health counseling, paternity, newborn care, and the list goes on. We have really good quality insurance plans. Hand in hand with that, we also are the only source for financial assistance here in the Commonwealth of Pennsylvania for the individual health insurance market. Most definitely, people can come to Penny and they can learn about insurance from different carriers. Ultimately, what's the difference between shopping through Penny and shopping through, somewhere like an Independence Blue Cross or a Capital Blue Cross or a Geisinger, UPMC, or Highmark directly, which you can do that. The difference is we have financial assistance, and we'll get into that here in a second. My partner Juan has some scenarios he's going to go over that will literally brighten up that subject quite literally. We're in a good place right now. In fact, there's not been a better time in the history of the Commonwealth of Pennsylvania where individuals can get covered for incredible premiums each month. And when I say incredible, I don't mean expensive, I mean affordable. So we try to help individuals who fall into certain categories or gray areas. Number one, if you don't qualify for Medicaid or CHIP, Penny's here to help. If you're too young to qualify for Medicare or Medicare options, Penny's here to help. If you're a small business owner, sole proprietor, or small precision manufacturer, or even an agribusiness owner, Penny is here to help. If you find yourself in a position where you've lost your employer-sponsored coverage, you receive a COBRA letter in the mail, and you realize very quickly that that employer-sponsored coverage is incredibly expensive, Penny's here to help. Okay, so it's very important that you keep in mind that Penny, again, we're not an insurance company, we're the insurance exchange. And at the end of the day, we do work hand in hand with the Department of Human Services. We have a no wrong door policy. So if you come to Penny and through working with us, it's determined that you're best served by working with Medicaid or CHIP, we'll make sure that you get a warm transfer to Medicaid or CHIP. Even your application information will be transferred, okay? So we try to help in that regard. Why? Because about 1 in 20 Pennsylvanians, as we sit here right now, 1 in 20 of our friends, our neighbors, maybe even family members, are in a position where they go out into the world every day without the protection afforded by health insurance. Now, why is that significant? Well, we'll get into that here in a second, but it's significant because nationally, the #1 trigger for bankruptcy in the United States are unmanageable medical bills. Penny's here to help. We have financial assistance, and we want to change a lot of the fears and apprehensions that people have about health insurance. We've got 4 different levels of service that are free, completely free. #1, we realize that not everybody, wants to work directly with people. Sometimes people just want to do their own thing online. And if that's the case, Penny gives you the option of shopping anonymously. And then ultimately, if you want to purchase health or dental insurance, you can do it on your own terms. Our application is very simple. Our platform is very easy to use, both in English and Spanish, by the way. So our online self-service is something that a lot of people take advantage of. But we also recognize the fact that nobody is born with an inherent knowledge of health insurance. It's a complex subject, and for a lot of people, it can be confusing and frustrating. So we have our customer service center, 844-844-8040. And what's interesting about our customer service representatives, first and foremost, they're unbiased. They do not work for insurance companies. They work for you. They work for the residents of Pennsylvania. And they can help individuals determine what level of financial assistance they qualify for. They can help individuals determine what types of insurance and what different plans are available for them in their market. And then ultimately, they can help anybody secure the health insurance that they need to preserve their quality of life. So that's important for a lot of people, but we also realize that not everybody likes to work online. Some people just detest working on the phone. So we actually have thousands of Penny certified brokers who are the only licensed professionals in Pennsylvania who can actually make a professional judgment on your behalf. If you're utterly confused, they're the best resource to connect with. And as I said, straight from penny.com or with one call to our call center, you can get the information on the brokers who are in your area so that you can connect with them in person. Set up an appointment, go to their office, or meet with them virtually, depending upon how things are. These days, virtual is still good, but it's somebody from your local community that can be there to help you. Now, we also have Penny certified assisters. Our certified assisters work for hospitals, health centers, faith-based organizations, community organizations throughout Pennsylvania. And they are also, much like our customer service representatives, they don't work for insurance companies. They're in a position to provide you with unbiased consumer education so that you can make the decision that's right for you. So all of those levels of service are free, 100% free. But going back real quick to where the uninsured live in Pennsylvania, what you'll see here is a heat map that represents about 607 of our friends and neighbors who every day they wake up and they go out into communities across Pennsylvania without health insurance. If 2020 and 2021 have taught us anything, it's that taking that risk is something that people shouldn't do as long as there is a viable alternative. And that's where, that's where presentations like this really help as a community resource. And I say that because Penny is a new agency. We are 1 year and 1 month old. It's incredibly important that we be able to get the word out to as many communities as possible, because we need everyone's help in remedying this disparity between those who have insurance and those who do not. Again, you'll note the darker the blue in this heat map represents communities where there is a higher number of uninsured. But don't let this map fool you. While you might see, 57,000 uninsured in Lancaster, when you start to get up into, other areas like Center County, Clearfield County, even Erie, you'll see that you're looking at a number of uninsured that is, generally speaking, it's significant because of the number of population, the population size in those areas. So again, the important thing is that there's good news for these 607,000 Pennsylvanians. And that brings me to the American Rescue Plan. This has been one of the most significant advents to go hand in hand with the launch of Penny here in the Commonwealth of Pennsylvania. Number one, we have available to us for 2021 and 2022, for plan years 2021 and 2022, enhanced financial assistance. And what we've been able to do is remove what was known for many years as the subsidy cliff here with health insurance. And again, the biggest question, the biggest challenge for most people is, can I afford health insurance? Well, the removal of this subsidy cliff has made financial assistance available for the first time to everyone, regardless of what your income is. Okay. Typically before the American Rescue Plan, if you made $51,000 a year, or if you're a family of 4, if you made $105,000 a year, you weren't eligible. After that point, you weren't eligible for financial assistance anymore. So now we're in a position where we're able to cap premiums, the monthly premium that someone pays, at no more than 8.5% of the household income over 400% of the federal poverty limit. Now, my partner is going to go over some scenarios that will help clarify this. But the important thing to keep in mind is, number one, Penny has right now, we have a hard deadline that's approaching. Our open enrollment for 2022 coverage opened up on November 1st of 2021. On December 15th of 2021, we want to make sure that as many people as need insurance apply, because they can have coverage in place by January 1st of 2021. Now, we also recognize that not everybody's going to be able to, meet that deadline. Well, as part of the local control we have as a state-based exchange, our open enrollment here at Penny doesn't end until January 15th of 2022. If you apply between December 16th and January 15th of 2022, you'll be in a position where you will qualify for February 1 of 2022 coverage. So with that being said, I'm going to turn things over to my partner, Juan. And Juan, if you would take them through some scenarios on the American.
Thank you. And I just want to, before I start, just want to thank you again to the library team. Libraries are extremely important in Pennsylvania. They are like a hub of resources where people come and to find information. And we have been there in person doing this type of activities, and we really value the type of work that you are doing with the community. So I just want to thank you for helping us to have this conversation with the community. So American Rescue Plan is perhaps one of the best news that we have received. Some people know American Rescue Plan because the stimulus checks, but a lot of people don't know that there are certain important implications in funding for healthcare to make healthcare more accessible. Here is a typical example of 40 years old. He's a non-smoker. He lives in Philadelphia County, and he's making about $20,000 a year. Prior to the American Rescue Plan, this individual was paying a monthly premium of $66. So that is a year about $792, right? That it's a lot of money for someone that is only making about $20,000. So under the American Rescue Plan, the monthly premium of this individual will be $0. So literally providing a saving almost $800 a year. So this is the type of savings that thanks to the American Rescue Plan, customers at Penny are receiving right now. We can show you another example that is extremely important for a community that is very close to us, or older adults. This is a married couple, 64 years old, so they are not yet in Medicare. They are non-smoker. They live in Dauphin County, and between both of them, they are making about $77,000 a year. Prior to the American Rescue Plan, because the age, health insurance was very expensive. A monthly premium of $2,400 a month. That's a lot of money for this couple. Literally, is the percentage of their income designated to healthcare was about 38.1%. Now we remember that Scott mentioned before that one of those benefits of the American Rescue Plan is that they remove the cap that was basically gives you a cap of 8.5%. You cannot pay more than 8.5% of your income, annual income, in healthcare. That's a great news, because right now this couple are paying right now $550 a month. Literally, they are saving almost $2,000 monthly. We're talking about $23,000 a year. They can literally buy a car. So this is a very deep example of how the savings have been big for many communities, many older friends and family and neighborhoods that are here in Pennsylvania. This is a family of four. This is our last example, but I just want to show you as well. Family of four non-smokers. They live in Allegheny County, and they are making about $52,400 this annual income. Prior to the American Rescue Plan, this family was paying $285 a month for health insurance. But under the American Rescue Plan, because the financial assistance that Penny is able to provide, And thanks to the American Rescue Plan as well, this family is paying $87 a month. It's almost $20 per person a month, which makes important, significant savings for this family. So they will be saving around $200 a month, which is like $2,300, $2,400 a year. Okay, those numbers are important, but these numbers are extremely interesting. Is in Penny right now, we have about 337,000 customers. That's a lot of customers that we have. 50% of our customers are paying $1 or less a month for health insurance, and for a good health insurance. So that's why Scott was saying, it has never been so healthcare access more affordable as right now in Pennsylvania, in the Commonwealth. 68% of our customers are paying less, $50 or less a month. Since the conception of Penny, we have added 65,000 new enrollments, and we have kept something that is also, it's a good record. 97% of our customers, we have been able to retain those customers that were transitioning to us from healthcare.gov. So that means that there's a lot of satisfaction in what we are trying to do here at Penny. The question always is, where can I get cover? And that's actually the big news. And I just want to emphasize that basically is until next Wednesday, December 15th. If you want to have insurance starting in January 1st, you have until next Wednesday. So you are more than welcome if you're looking for health insurance, or if you know someone in your family or friends or neighbors that are looking for health insurance, this is the time. Literally, we have a week for them to enroll at Penny. They can call the 1-800 number or use a broker and a sister and get enrolled quickly. But so if you miss that date of December 15, you still have until January 15, but you will be enrolled in February 1st, so next year. So why miss a month and an opportunity just to be safe? Get insurance as soon as possible. If the cost is so affordable, right? Cover yourself, but most important, make sure that your family is also covered. So we just want to remind everyone our Penny call center phone number. Those are the 4 types of help that we provide at no cost. Our phone number is 1-844-844-8040. As soon as you get to penny.com, you will also see that number there for customers to call. Our call center is right now, because we are in open enrollment, so they are open from 8 a.m. to 7 p.m. Monday to Friday. And Saturday, we also have hours from 8 a.m. to 1 p.m. We have, just to give you an idea, we're receiving about 4,000 calls a day right now. We have more than 260 agents answering the phone. About 25 of them are bilingual in Spanish. We also have a translation or language services that provides support for more than 240 languages. So that's important as well, because, as you know, Pennsylvania is very diverse. We want to make sure that people understand very well what the options are for health insurance and the benefits of having our own marketplace. Secondly is our network of brokers that definitely you can find at penny.com. Find a broker in your community. Just add in your zip code. There's a directory there. You will see the number of all the Penny brokers in our directory. And you can call them or request a virtual appointment if you have any questions, especially for those complicated cases. They help you to narrow down your options. Important as well is that your health centers are connected to Penny. So wherever you are in Pennsylvania, we try to make sure that we develop those connections. So nonprofit organizations and health centers usually have social workers or outreach people. Many of them are assisters, part of the network that we have in Pennsylvania called our Penny Assisters. Lastly, you can actually just send us an email through our penny.com website. Any questions that you may have here, from the bottom of the company to the top of the organization, we are all focused in customer service. That's why literally your feedback is important. Your navigation in our website has to be easy. Your experience has to be good. That's our commitment and the reason why we are here. We are state employees. We are here literally to serve the residents of Pennsylvania. That's all in our presentation, and we would love to know your comments, your feedback, on your questions as well.